Good morning. Welcome to the 2021 Fairfax Food Council Virtual Food Summit, Empowering Equitable Solutions, Collaborations During COVID and Beyond. We are extremely happy to have so many people joining us today to be a part of this opportunity to broadly and yet succinctly dial up examples of the wide array of food system responses our Fairfax community experienced throughout the pandemic. I'm Diane Charles, the project manager for the Fairfax Food Council. The Food Council is a community coalition that is made up of citizens, nonprofits, faith partners, community agencies, and businesses who are all committed to equitable, healthy food access for all, especially in underserved communities. The vision of the Food Council is a vibrant food system where healthy, accessible, and affordable food is valued as a basic human right. Its mission is to facilitate community partnerships and efforts to promote healthy eating. We are very grateful to several organizations who are key supporters of the work of the Food Council and specifically supporting this summit today. The Virginia Foundation for Healthy Youth is a year-round supporter and partner of the Food Council, and they are a major sponsor today. The Capital Area Food Bank is also a valued partner and an additional sponsor of today's lunch. We are also very grateful to George Mason University in their partnership as our Zoom platform partner and technical support prior to and for today's virtual gathering. The Fairfax Food Council is a proud member of the Partnership for a Healthier Fairfax, and we're housed in the Community Health Development Division of the Health Department. Our hope is that today's summit will build upon the Food Equity Summit held in 2019 and use the many experiences of the past year to continue moving in the direction that put equity challenges at the forefront of our lives. We are all too familiar with the light that shined on the disparities in our society during the pandemic. The food system experienced the glare of that light as well. Today, we hope to share a story woven together from many stories that are inclusive and yet broad. Of course, there are just too many stories to tell in 2 hours. What the Food Council has done in preparing for today is to bring to the forefront leaders who represent so much of what so many people took on during the pandemic as a way to help all of us reflect together and then also move forward together. Can today's many reflections help us to navigate a response together? We hope so. As representatives of what so many in our community jumped into as it relates to our food system, today's speakers will aim to capture the rich information, outcomes, and models of response that were carried out throughout this past year. The context is important, so I want to mention a couple of numbers that develop a snapshot of the impact in Fairfax. In 2018, Feeding America reported that the food insecurity rate in Fairfax County was 5.4%, equating to over 61,000 individuals. For 2020, Feeding America projects that Fairfax County's food insecurity rate was approximately 8.3%, representing close to 99,000 individuals. As we are all acutely aware, the pandemic put many people on the edge, and access to healthy food became a challenge for increasing members of our community. Our entire food system was put to a test in which the grade was not stellar. Nonetheless, there have been very valuable lessons and unique and new collaborations that we'll hear about this morning. These collaborations should continue, and they can provide the backdrop for continuing to seek innovative ways to address food inequities in our food system. We know working in silos does not move us forward, so we can't just address food access. We must begin to address root causes, such as poverty. The pandemic itself actually sped up collaborations amongst many sectors: education, government, business, nonprofits, and the faith community. It has been obvious that these collaborations deliver in much more meaningful ways. We don't want to lose momentum. Our agenda today will touch on each of these areas. Before we get underway, I want to acknowledge that we are extremely honored to have some elected officials join us today. We know that the issues around our food system and food access and food equity are only able to be positively addressed in partnership with so many in our community, and that includes our solution-focused policymakers. Thank you for joining us today. In fact, we are grateful so many people are online with us today for this virtual food summit. A special note of thanks to all of our presenters, and a huge thank you to the team of the Food Council members who worked very hard to bring today's event to you. Their commitment to improving the food system, including their belief in bringing everyone to the table, is much appreciated, needed, and admired. Finally, I do have just two housekeeping notes. We will host a question and answer time at the conclusion of today's summit. Please feel free to submit any questions throughout the summit, but we will hold them for our speakers to answer at the end. And finally, after we wrap up today's summit, for those who registered for lunch, the 3 food trucks will be at the Government Center and will be ready for you to pick up your lunches between 12 and 2. We have an extremely full and ambitious agenda, and our speakers have worked diligently to make their remarks concise and rich. I'd now like to turn this over to Annie Turner, Executive Director of Food for Others and one of the co-chairs of the Fairfax Food Council, who will introduce our first speaker and topic for the morning.
Thank you, Diane. Our first session today will be health sector collaborations. The COVID-19 virus disproportionately affected people of color and low-income families across the nation, widening the gap of economic inequality. While 16% of the population in Fairfax County is Latino, more than double that number were impacted by COVID. Very quickly, service providers realized the importance of providing multiple services in one visit. These new models of food access helped ease the economic burden and reduce exposure to disease for our most vulnerable populations. Here to tell us more is Sharon Arndt, who serves as Division Director for Fairfax County Health Department's Division and Community Health Development. Throughout the COVID-19 pandemic response, she has served as Assistant Liaison Officer for community and nonprofit sectors. Next, we'll hear from Kate Garson. She is the Manager of Program Outreach and Education for Innova's School and Community Partnerships Department. In this role, Kate manages the Healthy Plate Club and other programs to increase food access and reduce childhood obesity among low-income populations. Sharon?
Hi, good morning, everyone. Thank you for the opportunity to speak with you today. We all know this has been a marathon navigating this pandemic for our world, our community, and our families. When I looked at this graph of over 78,000 COVID-19 cases in Fairfax, I could recall our tremendous journey throughout the past 15 months. And this graph only shows disease. It does not show the many, many residents who suffered from pandemic-related income loss and food insecurity since March 2020. Everyone here should be commended for their efforts to feed our community and for your partnership in public health. Next slide. As a public safety agency, the health department has plans and trains for public health emergencies, but the success of our long-term pandemic response is built upon the existing capacity in the community. I want to acknowledge the foundational resources we had within Fairfax that supported the early collaboration and mobilization of enhanced resources for COVID response, especially for our families who needed access to basic needs such as food. Coordinated services planning, supporting and coordinating emergency basic needs for over 20 years. The Fairfax County Public Schools Food and Nutrition Services, our food providers network of pantries, and established in 2015, the Fairfax Food Council, whose multi-sector members have convened to implement objectives over the years, such as increasing the amount of healthy food donated to pantries, expanding enrollment in food benefit programs such as SNAP and WIC, and raising awareness of food insecurity as a public health issue that is a precursor to poor health. Next slide. Throughout the pandemic, our public health objective has been to stop the spread of disease. Our consistent messages have centered upon protective behaviors that you are all now well versed in. Next slide. Our local public health response also sought to contain the disease with a box-it-in strategy, which I'll highlight in a moment. Many of you and your organizations helped us to distribute over 150,000 face covers to residents who did not have these sustainable and protective resources. Next slide. To facilitate connection to residents, public health outreach joined many of you in the food distribution lines to inform about upcoming testing in the community, protective behaviors education, and connection to services. Also, we offered connection to food benefits and other emergency basic needs to those who attended our community testing events, whether or not they were positive for disease. Next slide. Our box-it-in strategy required the isolation and quarantine of over 105,000 residents. Over 51,000 cases needed to isolate for 10 days, and over 53,000 cases or contacts needed to quarantine for 14 days. The health department's containment branch had a community health division, which consisted of 70 community health workers who served those residents who required food assistance to successfully complete their isolation or quarantine time period. The community health workers served almost 36,000 individuals, with 10% of those they served needing emergency food assistance for themselves and their household. This food assistance was critical to ensure residents stayed home without worry about feeding their families. The Community Health Worker Division was stood up in June 2020 and brought to full capacity over the summer. They were enthusiastic and mission-driven. The community health workers at such a scale were new for the health department. There were initial disruptions such as destabilizing activities of accessing pantries beyond the pantry service area, but with guidance and alignment with coordinated services planning, organizational service areas, and CARES Act funding resources, the community health workers were soon underway and a lifeline to bring food directly to doorsteps for many isolated and quarantined residents to feed their families. Next slide. Food was procured from a multitude of sources, including, but not limited to, faith-based centers, food pantries and food banks, nonprofits, and other community-based organizations. The Community Health Worker Division sought to provide culturally appropriate foods as often as possible, which was supported by partnerships such as Dar al-Hijra Islamic Center and Cornerstones, among others. The community health workers served as a liaison between the client and the community-based organization to facilitate other immediate and longer-term service needs. I can't highlight all of the amazing food efforts to feed our community during the pandemic, from shopping for an individual's grocery list to feeding large families, but here are a few. On this slide here, we have pictures of Burke United Methodist Church, Action Chapel, Virginia, Abiding Presence Lutheran Church, and I don't have a photo, but Food for Others was a consistent and important food bank supporting the community health workers' food procurement on a regular basis. Next slide. Here you see Sister Annie from Christ House, who helped to feed many large families, such as a family of 13 with specific dietary needs. She was able to meet the family's dietary requests and made sure the family had ample food throughout their quarantine and isolation period. As another example, Good Shepherd Catholic Church was very responsive when contacted by community health workers. They enthusiastically provided food, masks, medication, and cleaning supplies to many families in need of assistance. They recognized the continuing need for community support and created an ongoing donation drive for those items to support the community health workers' mission. The support of our food pantries and the community health workers' efforts to connect families to the food they needed was a benefit to alleviating the stress of disease diagnosis and supporting every family's ability to stay home to keep our community as safe as possible. Next slide. In addition to providing food sourced from community-based organizations, the community health workers utilized gift cards as a supplement, especially on major holidays and weekends when food banks and pantries were not operating. Bright Paths and Cornerstones provided 446 gift cards funded with CARES Act dollars. When purchasing foods for clients with a gift card, community health workers always strive to provide fresh produce and healthy options that contributed to the client's overall health. Next slide. We are now stopping the spread of disease through vaccination. Public health led the effort to vaccinate essential workers, and through our vaccine equity strategy, we are helping to connect residents who are most under-resourced to vaccine. Our public health outreach for vaccination has often aligned with food distribution. Next slide. Here you can see a mobile vaccination clinic that was successfully held and vaccinated nearly 350 residents following vaccine education and registration co-located with a Food for Others food distribution. Next slide. So where do we go from here post-COVID? Our definition of public health is what we do together as a society to create the conditions in which everyone can be healthy. And our focus on the social determinants of health have been highlighted as critical to the conditions in which everyone can be healthy. I think this pandemic has shown most broadly is that what people often thought of health as something we get in a doctor's office is incomplete. The individual care we receive in a healthcare setting is important, but it is not enough. Health starts in the community and is shaped by our conditions in our environment. Throughout this pandemic, the Fairfax Food Council and all of its many partners and organizations have shown that food access, food quality, and food security are one of the core determinants of health. Don't let a good emergency go to waste. Seek the policies and resources needed to sustain and enhance our local food system so that all in our community may thrive. Once again, thank you for your efforts and actions to support each other and our community throughout this pandemic. Next slide. And at this time, I would like to hand off the presentation to Kate Garson from INOVA. Thank you.
All right. Hi, everyone. My name is Kate Garson, and today I am going to talk about 3 initiatives that INOVA started related to food access during COVID, and 1 initiative from Medical Care for Children Partnership Foundation, MCCP, as I represent INOVA on their board of directors. So INOVA is a network of hospitals, primary specialty care clinics, urgent care centers, and we have more than 18,000 employees here in Northern Virginia. The first initiative that I will talk about is the emergency food pantry that we started at our clinic for women and children, which is located in Falls Church. This clinic for women, we provide OB/GYN services, and for children, we provide comprehensive medical care, well visits, sick visits, nutrition counseling, and so forth. Our patient population at this clinic is primarily uninsured, specifically among our women, and many of our children are on Medicaid. Our income eligibility is 400% of the federal poverty level, And about 90% of our patients are a minority population. Specifically, 80 to 85% of our patients are Hispanic. And so we've known there is a high rate of food insecurity among this patient population. And obviously, as we all know, it was amplified during COVID. So we decided to start an emergency food pantry to help support our patients who were significantly struggling with food insecurity. And our pantry, as you'll see pictured here, is a great example of how any organization can start a food pantry to help the clients it serves, especially when you don't have a lot of space and you don't necessarily have the infrastructure to do it. We found a closet that we were able to clean out. We were able to sanitize it. So we only store food in there. And the closet also locks, and only the managers at the clinic have key card access. This pantry would not be possible without the generous partnership with Food for Others. They provide us food bags on a regular basis, and we've also received donations from community and ANOVA team members as well. In terms of how we track the food, this is a question that has been asked before, because we have to report accurately to Food for Others how many patients were served with their bags, as well as the number of household members. So as you hopefully can see in this picture, we have specific shelves that are designated just for Food for Other bags. And then our tracking system is very basic. We use those patient barcode stickers that I'm sure you've seen when you've been at the doctor, when you're getting lab work done. We have tracking sheets that we keep in a secure locked location. So whenever we give a bag of food to a patient, our managers take one of those stickers, write the number of household members on it, and then we have an easy tracking system that fits in really well with our current patient flow process. We use the hunger vital sign screening questions. I'm sure many people on this meeting are familiar with them. We have them in our electronic medical record, and then our medical assistants point them out. They're posted in every exam room. And then our physicians are the ones who ask the questions and then make the referral for the food bags. One thing I really want to highlight is our staff took this on in the middle of fighting COVID, when they were dealing with gowns, with temperature checks, and with that fear, is this next patient going to give me COVID? And this was an extra process. It was an extra step on top of everything else. And that's something I'm really proud of, because it really shows how dedicated our team members are to our patients. So since we started this pantry in October during COVID, we've served 95 patients and nearly 400 household members. We are now in the process of starting food pantries at several other clinics and getting additional partnerships on board to supply the food. And we are also, we've recently hired community health workers to address food insecurity needs among patients as well. The next initiative I'm going to talk about is a food drive we did among our team members to support our patients who were struggling with food insecurity during COVID. We did this drive over the holiday season, and we had employees from across the system, Alexandria to Mount Vernon to Loudoun, and everywhere in between. And typically one employee from each department, whether it was the NICU at ANOVA Alexandria or blood donor services, they would collect everyone's food and bring it to one of 3 drop-off locations we had set up where we would come get the food. So we were able to collect more than 2,000 pounds of food to support our patients. And the food went to patients at 6 of our clinics that serve low-income individuals, as well as several of our service lines, as you'll see listed here. And then the last initiative for ANOVA that I will talk about is how we paired nutrition education with food access during the pandemic. We have a program called the ANOVA Healthy Plate Club, which we specifically run at Title I schools. We provide nutrition education, and we expose kids to vegetables that they've never had before. And we teach them how to prepare these vegetables in ways that actually taste good to them. So when COVID hit, we decided to take this program virtual, but cooking was, probably the most impactful part of this program. And so as we were talking about how we could have that impact virtually, we decided to give kids all the ingredients that they needed to cook along with us. So, I mean, the families were getting whole heads of cauliflower, huge bunches of kale, the ingredients to make a healthy stir fry for about 2 to 3 people. And so, for us, it was a way we could continue to engage kids, continue to educate them, but also provide families with a little bit of extra food. And this virtual program, it would not have been possible without working with partners to help us identify families in need and families who might want to do this program. We worked with food pantries, we worked with schools, many nonprofits and community organizations, and we've had about over 300 kids participate in this program during this past virtual school year. All right, so moving on to MCCP, Medical Care for Children Partnership Foundation. They provide access to comprehensive medical and oral health care services for children. They have a dental van which goes to Title I schools, underserved areas to provide dental screenings for children. The van is large, as you can see in the picture. They have 2 full-size dental exam rooms in there. And obviously, when COVID hit, they had to halt on the dental screenings. So they immediately pivoted and began using the van to transport food to communities in need. The van, as I mentioned, is very large, and so they were able to transport large amounts of food. However, MCCP had never done food distributions before. The business of food was completely new to them. So they partnered with several organizations, as you'll see listed here, Food for Others, Capital Area Food Bank. They work with Giant, and they were even driving into DC on a regular basis to pick up the prepared meals from World Central Kitchen. They serve the community right in Colmore. For those of you familiar with the area, that's the Bailey's Crossroads community. They started doing daily distributions, and they're now doing monthly distributions on every month. And they had a core group of volunteers, of workers at first. Now they have a huge group of volunteers, as you'll see pictured here, who come out every month. And they really have the goal of making it more of a comprehensive resource for families. Annie, I see you're popping up. So I will just end with MCCP came away with 2 key learnings to build trust with communities. The first, they listened to what clients want, and they shifted to doing a more culturally appropriate food distribution. Almost 100% of their clients are Hispanic, and they kept coming back. They heard directly from clients, we knew we could count on you every month for food, so we could allocate our resources elsewhere. Thank you.
Thank you so much, Kate and Sharon, for the informative discussion. Next, we'll highlight equitable partnerships, stimulating businesses and feeding communities. Last spring, restaurants were forced to close and in-person events were shut down, devastating local food businesses. According to the National Restaurant Association, 2020 restaurant sales were $240 million below pre-COVID projections. Even though food businesses themselves were struggling, a few stepped up to continue to serve our neighbors in need. This morning, we will hear from 3 representatives who figured out how to provide economic stability for the local food system workforce, while at the same time providing prepared meals to the food insecure in our community. First, we'll hear from Don Hyman, who is the project manager for One Fairfax and works on various community initiatives to advance racial and social equity. Her passion for creating an equitable, just, and sustainable food system was instrumental in the conception and execution of the county's first Food Equity Summit held in May 2019, and also led her to launch the Coalition for Equitable Food Access and Economic Relief pilot program in June 2020. Lori Ann Grimes is the general manager of Frontier Kitchen. Frontier Kitchen is a food business incubator kitchen that is based in Fairfax County. Currently, they are helping 100 small food vendors become successful food businesses. And last, we'll hear from Cheryl Bonenberger. She has led the philanthropic and volunteer initiatives at Great American Restaurants since 2015. Great American Restaurant's newest initiative, the Great American Community Kitchen, is a 501c3 charitable organization providing prepared meals to communities in need.
Thank you, Annie, and good morning, everyone. Thank you for the opportunity to present to you today. To kick off this session, Lorianne and I wanted to share insights and information about the Coalition for Equitable Food Access and Economic Relief Program that was launched in response to COVID-19. Next slide, please. So here's the down and dirty of our presentation today. We'll learn about what the Coalition for Equitable Food Access and Economic Relief is. We'll get to know the partners, their roles, and the program goals. We'll do a program overview using the 5 dimensions of food access. We'll share a few narratives of the impact the program has had, and then we'll close with next steps. Next slide. So what's the Coalition for Equitable Food Access and Economic Relief? It's an innovative cross-sector partnership between government, nonprofits, and businesses that leverages resources and assets to address a community-identified need. Now, the premise for this partnership was based on several things: recognizing that inequities have a long and pervasive history in our food system, and that these inequities were exacerbated by the pandemic, especially around food access and food insecurity. The foods available through our food distribution networks were not always reflective of culture, ethnicity, and religion, and that the hospitality and food industry was crippled by the pandemic, with many having to lay off workers and even close businesses. And so the question remains, how do we equitably stimulate businesses and feed communities at the same time in response to a pandemic? Through data, engagement, planning, and coordination, this coalition and program was born and executed 2 phases. Phase 1 was launched last June, serving 250 Muslim families with prepared halal meals and grocery staples for 6 weeks. In phase 2, the program was extended by 4 weeks and expanded to include 81 Hispanic families for a total of 331 families being served. Next slide. As previously stated, the coalition is a cross-sector partnership between government, nonprofits, and businesses. So let's take a deeper look at those partners and their roles. For government, it was Fairfax County, responsible for program management and funding. For the nonprofits, it was ICNA Relief and Facets, responsible for volunteer and resource management, data collection, site and client selection for program participation, and the pickup and distribution of prepared meals and grocery bags. For business, it was Frontier Kitchen, responsible for program and food vendor management. And the 4 businesses that participated in the program were Bon Bonnie, Sour Dog, Cole Monty's Catering, and Alfresco Caterers. Each of these vendors have experience working with culturally and religiously diverse foods. Next slide. The goals for this program were twofold. First, to address inequities around food access and food insecurity in culturally, ethnically, and religiously diverse communities. And second, to provide economic support to local small food businesses impacted by the pandemic. Next slide. For those of you who attended our 2019 Food Equity Summit, we conducted an exercise to explore a more intentional and expanded definition of food access across 5 dimensions, which include acceptability, accessibility, accommodation, affordability, and availability. We pulled out certain elements of each dimension that aligned with the perspectives and experiences of the nonprofits and businesses in this program. Those perspectives and experiences were grouped into themes. Next slide. For our first dimension is acceptability, where we focus on the attitudes towards the quality and cultural appropriateness of the food being distributed. For the nonprofits, the theme was around the importance of community voice, which provided the coalition with greater insight about culturally, ethnically, and religiously acceptable foods.
For the businesses, the themes were around knowledge, skill set, lived experience, and authenticity. Using the community's voice, Frontier Kitchen selected food vendors with a skill set and lived experience of preparing culturally, ethnically, and religiously diverse foods. These vendors assembled grocery bags with staples and prepared meals that spoke to the authenticity of the culturally and religious diverse communities. Next slide. Our second dimension is accessibility, where we focused on location and travel resources. For the businesses, the themes were around creating a distribution. We're creating a distribution system and participation. Frontier Kitchen created an accessible distribution system for ICNA Relief and Facets to gather and distribute prepared meals and grocery bags to their respective clients. In addition, Frontier Kitchen cast a very wide and intentional net that afforded opportunities for culturally diverse small food businesses that were impacted by the pandemic to participate in the program.
For the nonprofits, the theme was around resource utilization. Facets and ICNA Relief leveraged their transportation and volunteer resources to pick up and distribute prepared meals and grocery bags. An important part of this program is getting food to where people are and in ways that are accessible to them. As such, Facets distributed prepared meals and grocery bags to families on site where they lived, either at Reagan Oaks or Wedgwood Apartments. ICNA Relief implemented a curbside delivery approach where families drove up, checked in, and prepared meals and grocery bags were placed in the back of their vehicles. Next slide. Our next dimension is accommodation, where we focus on hours and clients' ability to meet those hours in food displays and packaging. For the nonprofits, the theme was around a contact-free weekend distribution, adhering to social distancing and mask protocols. Utilizing data, nonprofits and businesses created a pickup and distribution schedule for prepared meals and grocery bags.
For the businesses, the themes were around food packaging and mentorship. Based on feedback from the families, the businesses revamped their food packaging to better accommodate the appropriate distribution of prepared meals and groceries. For mentorship, Frontier Kitchen accommodated the needs of participating small food businesses by providing guidance and direction with ordering, meal planning, food storage, troubleshooting, and financials. Next slide.
Our next dimension is affordability, where we focused on food pricing and clients' ability to purchase food. For the nonprofits, the theme was around purchasing power. As recipients of the prepared meals and grocery bags, families could use those monies that they would have applied towards food on other expenses.
For the businesses, the themes are around cost reduction and reemployment. Small businesses were able to reduce costs through bulk purchasing as a result of rising ingredient pricing, essentially getting quality foods for less. As a result of this and other cost efficiencies, the small food businesses were able to afford reemploying workers as they had previously let go at the beginning of the pandemic. Next slide. Our final dimension is availability, where we focused on a variety of available small food businesses from one resource. The theme for both nonprofits and businesses was around collective interest. Everyone had a vested interest to ensure that a variety of healthy, cultural, ethnic, and religious prepared meals and grocery bags were equitably distributed to communities navigating inequities with food access and food insecurity. Next slide. Impact. Businesses enabled small food businesses to adapt to new conditions, diversify offerings, develop new skills and confidence in large-scale food production, and managing complex business operations. Nonprofits help to meet immediate food needs and build a sense of belonging, with new families becoming engaged in other programs. Government affirmed the importance of fostering partnerships across various sectors, leveraging those relationships and resources to address community needs. Next slide.
And in closing, our next steps include expanding the program to include other vulnerable food insecure populations, as well as developing a sustainable model that will continue to carry this effort forward. Next slide. Thank you all again for this opportunity to present. And now I'll turn it over to Cheryl with Great American Restaurants.
Thank you, Dawn. Good morning, everyone. My name is Cheryl Bonenberger. I am with Great American Restaurants, and I'm going to spend a little time today talking with you all about the impact COVID had on our operations, as well as the role of community meals on our recovery. To quickly give you some background on Great American Restaurants, we're a privately owned restaurant group in Northern Virginia and Maryland. We operate 14 full-service restaurants and 2 bakeries. And before COVID hit, we really did not have carry-out service or didn't offer to-go service. That just wasn't really a major part of our operations. Next slide, please. To give some impact on COVID on our operations, I wanted to start this morning by sharing some numbers. So beginning in early February, we really started to see the impact. Our guest counts were starting to decline, sales were going down, but we truly hit kind of our lowest point of the pandemic in early March, early to mid-March. So by March 20th, several of our locations, it was not unusual for them to see sales being less than 10% of what they would be on a normal day. So across the board, we were seeing sales down roughly 90%. More disastrous than this, though, of course, was the impact that it had on our team members. Several of our restaurants let go a significant amount of team members. And we had to temporarily close 3 of our restaurants. We reallocated that staff and those resources in order to better keep all of the businesses going. And at the time, to give you just a sense of where our carryout sales were, they made up less than 2 to 3% of our total sales. So carryout, again, was just really not a big part of our operations. Next slide, please. So March 21st is really what we considered our pivot day. This was the day that our CEO made our path forward very clear for us. He stated that we were no longer in the hospitality business, we were in the business of employing people. And what he meant by that was really that we were moving forward with the focus and the #1 goal really to bring back our team members. With dining rooms closing and guests no longer comfortable coming in to dine with us, that was presenting some significant challenges. So what we really needed in order to bring our teams back and begin rebuilding was time. We needed time to start putting infrastructure into place to get the carryout sales operations where we needed to be so that they could support the volume we would need in order to continue moving forward. Next slide, please. That time really came to us through community support and donated meals, or what we call community kitchen meals. You can see some examples of them here on the screen. For those who may not be familiar with community kitchen meals, those are meals that our guests purchase and they are prepared and delivered by us to community organizations. Now, at the start of the pandemic, we really used these meals and guests were requesting they be sent to first responders, local area hospitals, things like that. But it didn't take long for that to shift. And I think everyone became more and more aware of the impact the pandemic was having on our food pantries and on the food insecure. And those meals really did switch to going to local area food pantries, community churches, and organizations that really focused on helping those in need. Next slide, please. So what did these community kitchen meals make possible? Well, by April 25th, a little bit over a month past our pivot day, we were able to offer back 700 jobs to our former team members. We had already reopened 2 of the 3 restaurants that had temporarily been closed. And between the carryout meals that we were able to ramp up and between the community kitchen meals, we saw sales increase to the area of being slightly less than 40% of what we would expect on a normal day. So this was by no means sustainable in the long term, but it was definitely the foundation that we needed to begin rebuilding and to bring back our team members and to start focusing on moving forward from this point. Next slide, please. So while a pandemic is clearly not an ideal time to start a new venture, our experience with community kitchen meals really showed us how great the need was. It was clear that the recovery process for many was going to be long. This wasn't, people going back to work was not going to be the quick answer. Many people had used their safety nets during the pandemic and were in an even more precarious position than when the pandemic first started. We also were starting to see at the food pantries people that had never had to use a food pantry before, and their recovery process was going to be equally as arduous. So recognizing that the need really was now and that it couldn't wait, we formalized our community kitchen program, and in November 2020 received our 501c3 status. To date, we've distributed over 150,000 community kitchen meals. And looking forward, we're excited to share that we've purchased a food truck and we will be distributing meals free of charge to communities in need in our area and working with local organizations and identifying those communities. I think I may have shaved some time off there, but that is my full presentation.
Thank you so much, Cheryl and Lorianne and Dawn. We'll now move to rapid response models. Almost overnight, schools closed, as did many of the small food pantries in Fairfax County. At the same time, the demand for food increased twofold, leaving large pockets of unmet needs. The childhood food insecurity rate in particular rose from 4.4% in 2019 to a projected 8.7% in 2020. These next two speakers will talk about how their organizations reacted quickly to meet the growing demand and overcome many obstacles to distribute food during a pandemic. We'll first hear from Mara Lee Gutierrez, who is the founder and executive director of Comunidad, a nonprofit which exists to equip and engage locally rooted community leaders. As a new organization, Comunidad works hard to respond to the needs of the community by engaging locally rooted community leaders and providing a platform for these same leaders to thrive. This year, Comunidad built a massive food distribution effort which provided food for the thousands of families in Falls Church and beyond. Then we'll hear from Maria Perron, who is the Director of Food and Nutrition Services for Fairfax County Public Schools. FNS participates in the USDA child nutrition programs and supports student success by preparing and serving healthy meals. Under Maria's leadership, the FNS team has served more than 15 million nutritious breakfast, lunches, afternoon snacks, and supper meals during the pandemic and to households throughout Fairfax County.
Thank you, Annie. Thank you, Annie. It's good to be with you all this morning. And thank you to the Food Access Committee for the invitation to share Comunidad's story today. And a special hello and good morning to all of you. I'm glad to be sharing. I want to start off by asking you a question. And my question is, do you know how many different kinds of beans there are in the world today? And actually, I just need to pause because I realized I didn't check two boxes that someone told me I should check before sharing. So let me do that again. Okay. So I thank you. Good morning. I want to go ahead and let you all know that there are 400 different kinds of beans in the world today. I'm not sure that you are aware of that, but I learned that, and I should let you know that I love beans. In the last year, I learned that the red silk bean is different than the small red bean, which is also different than the adzuki bean. I learned the important difference between rice grains and how some communities prefer one over the other. Comunidad learned a lot, not only about beans, but also about which rice noodles served our Asian community, as well as what were the preferences of our Middle Eastern neighbors. Early on, we decided lentils would be included in all of our food units because lentils, more than any other beans, were beans that crossed cultural boundaries. But before I share about our response, you should know that Comunidad is a small nonprofit, which I founded in 2018. And when COVID-19 struck, we were barely in our second year of programming. Our mission is to equip and engage locally rooted community leaders. We do this through our reading program that strengthens literacy skills of elementary age students, our Champions Mentoring Program, which engages high school and middle school students, and our Community Engagement Program, which invites locally rooted community leaders to work towards a common goal together. Each of these programs shut down due to COVID-19. We decided to provide food because, like all of what Comunidad does, we listen to our community leaders and determine our response based on the inherent needs. Our families were losing jobs 40, 50, 100 at a time. And on March 12th, like so many of you, we saw the tsunami rising of food insecure families. We got to task and we weren't sure how, but we would be part of the response. Beans, rice grains, rice noodles, dry goods versus canned weren't the only things we learned about. We would go from 0 to 60 in no time. We would learn to source food from local vendors until we found our way through the supply chain. We would learn about trucks, flats and their trailers, pallets, pallet jacks, and why having the right size plastic bag or box for food delivery is the game changer. So how did we build a response? And let me show you, this was what we started with. This is what we ended with. How did we build our response? First, ours was going to be a systems response. Two critical pieces of that were inputs and outputs. We would first ask ourselves the question about our output. Who was our consumer, our client? What were their needs? What would be the end product? What would be that would determine what food we would, culturally appropriate food we would have, what hygiene products and cleaning supplies we would allow. How about inputs? We decided that we would have a 3 to 6 p.m. food drive 7 days a week with a clear list of items for purchase, sourced from local grocers and farmers. We would then, oh, my apologies, seems like we had something go here with the PowerPoint. We would then determine 3 phases. We would have a phase 1, a delivery to clients, a front door. Comunidad, along with one of our volunteers, developed a bilingual COVID assistance request form for people to let us know they were in need of food. Initially, this online form was only accessible to individuals within a 5 specific zip codes. Every Saturday from 9 a.m. to 11 a.m. or 4 to 6 p.m., we'd have about 25 volunteers that would deliver food to the front doorstep of individuals in need of provisions. We would then move to phase 2, and phase 2 would be a large-scale on-site food distribution. The first 2 would be at one of our anchor partners facilities, the Falls Church Anglican Church, and then that's where we cared for over 1,000 and 1,700 individuals and families. And then we would also partner with the Falls Church High School in the distribution of 2 more additional large-scale food distribution. Phase 3 was our last phase, and it was meeting the communities where they were. Not everyone had internet access, nor did they know about our online COVID assistance form, but our end goal was going into the communities. We decided on locations based on the data we collected from the phase 1 COVID assistance request form. And every other Saturday, we would distribute over 300 units of food at 3 different locations for a combined 900 units of food to families and individuals in need. This was by far the greatest and preferred method of food distribution by our team because it maximized our impact with the least amount of resources required and human capacity needed. Now, I should let you know, Comunidad builds all of its responses taking into consideration 2 key aspects of engagement. The first is its relationships, and the second is its leaders. We ask, what's the relational and leadership capital we have with stakeholders and donors? In less than 3 weeks, we would launch our food distribution efforts thanks to the relational and leadership strength of Comunidad's anchor partners, volunteers, and our staff. In 6 months, we provided over 1 million meals at 10 different sites and served families in over 24 zip codes, thanks to the volunteerism and work of over 309 volunteers, serving more than 3,400 hours, thanks to our anchor partners and our temporary partners. This past year, in the midst of the chaos of the global pandemic, we saw dignity restored through the courage and kindness of so many. I'll never forget the story of the woman who wept after immediately opening the door and seeing Steve, one of our volunteers, arrive with bags of food for her family. He couldn't look at her because he too was weeping, a strong and husky mid-50s man. Or the story of the children who were home alone and whose mother I called while she was at work and beckoned her to open the door because we wouldn't leave the food unless somebody opened the door. Her children showed up together to open the door. Or the mother whose doorstep I arrived at for her to tell me we didn't know where we would get our food from today. We have nothing left. Or the men for whom standing in line for food was their greatest act of courage for that day. But one of my absolute favorite stories is that one of Anna Perez and her 2 sons, Ricardo and Charlie. Anna is one of Comunidad's locally rooted community leaders and was recently awarded the Volunteer Hunger Hero Award. She and her son, starting in last March, as soon as Anna heard about our efforts, she and her sons would show up every single week to volunteer at our food warehouse. Anna had also lost her job during the pandemic. Anna became one of the leaders at our community distributions, and she excelled in her leadership abilities. Late summer, I let Anna know we were planning on closing down our large-scale food distribution. And after making an appeal, she said to me, if there are 2 other leaders you find to help me, I'm willing to lead any future food distribution. Thanks to Anna, I decided to reach out to our friends at the Capital Area Food Bank. And since September of last year, we've been serving over 360 families. I'd like to share with you a few words that Anna and her sons had in appreciation for their award.
Sinceramente se lo agradezco de corazón a todos y también gracias a comunidad, a la gente que está atrás también trabajando, porque no lo gané yo solamente, sino que lo ganó todo el equipo, toda la organización de comunidad lo ganó, nada más que uno va en representación de ellos, pero no es que yo lo haya ganado, sino que lo ganamos todos.
It was awesome because the effort we put into everything, we never give up, even though if it was hard.
In the words of Charlie, I want to end by saying thank you for your commitment and thank you for never giving up. I'm now turning it over to Maria.
Thank you, Marilee. This is Kathy Ryan with FCPS. I'm going to be guiding a conversation with Maria Perone on FCPS's response into the pandemic. And I'll share my screen with all of you. Very good. So Maria, there we go. There we go. Pivot was also the key word to FCPS's response to the pandemic. Maria, can you talk to everybody about how quickly your team responded when school closed and how you continue to provide meals to students and why?
Sure. Thanks, Kathy. So FCPS, we immediately transitioned from school meals to community distribution. We started with 5 sites as soon as FCPS was shut down, and then we were in one site. We had 1 site per region within FCPS, and then we started adding on and layering in and innovating to be able to safely provide meals. So when we look at a normal school day, school meals must be provided and made available when school is in session. So FCPS continued to make meal access a priority. And we were really fortunate to have dedicated and brave staff that were willing to be on the front line from day one to be able to support our initiatives and provide meal access to the community.
Wonderful. So talk to us about providing meals to students. How many meals, how many sites did you end up with at the end of the school year, and about the bus delivery?
Sure. So we have served more than 15 million meals. We started with breakfast and lunch, and throughout the pandemic, we were able to layer on supper and snack. And as you can imagine, we had to adjust and make changes to the number of sites, the types of food distribution methods, and really change throughout the year. And when students returned to in-person instruction, that was really when we saw the biggest impact. But by the end of the school year, we had 74 meal kit sites. That's our bulk distribution. And then we had 5 grab and go daily locations where we were serving meals. And as you can see, we have an incredible support from transportation services, and they designed more than 50 bus routes and 400 stops, which allowed us to serve thousands of meals every day throughout Fairfax County.
Wonderful. So talk to us now about the creative solutions. How did you think through all of these different solutions to bring meals to the students?
So we focused on safety as our top priority. So keeping our staff safe and keeping participants safe really drove that decision-making process from the beginning. Our goal was to be easy, quick, and efficient, and just have that access to meal service available. So initially, grab and go meals is what made the most sense. We could be outdoors. Participants could come to schools that they're familiar with, and they could, be curbside, and our staff could really quickly distribute meals, and people could come and go and be safe. And then we immediately also began looking at bus routes, working with transportation to build these out, and thinking, what's the best way to get meals throughout Fairfax County? It's really to meet people where they are and where they live, and to be able to reach all areas of the county. So the grab and go and the bus routes were our first initiative in how we designed food distribution. And then as time went on and different opportunities came up and ways that we could distribute meals, we looked at how could we offer multiple meals, right? We wanted to be able to cover holidays and times when school is not in session, and offering multiple meals became really important, particularly during like winter break and spring break. Over winter break, we were able to offer 14-day meal packs to cover students and families for that 2-week period. And then in times of inclement weather. So whenever there was a chance of snow in the forecast, our team was able to regroup, pack out additional meals, and provide those meals in advance. So the multiple days was really helpful in making sure that families had food in advance of any time the FCPS would be closed. And of course, our meal kits, those were helpful to be able to provide 7 days of bulk meals to families once a week, just being able to be efficient and serving families, come one time, pick up your meal kit for as many kids as you have in your household. And that helped us to also be able to meet the needs of the community.
Wonderful. So talk to us too about, we don't do this alone. We have many key partners and collaborators and grants. Can you talk to the group about how integral they were to the success of the program with your team?
Sure, we were and continue to be very thankful and appreciative of the collaboration within FCPS and also outside of FCPS. We have some great relationships, and we're able to build on that during the pandemic. So, Fairfax County and Neighborhood and Community Services, they were there with us from the beginning, looking at areas of need and locations that they were aware would benefit from having nutrition support. So we did a lot of planning with that organization. We've received several very generous grants, 2 from No Kid Hungry and 1 from Nourishing Neighbors. No Kid Hungry allowed us to purchase really great, messaging equipment. So like flags and yard signs, so that way we could have a way to identify all of our locations that was consistent throughout Fairfax County. Our staff served meals in the cold, rain, and snow. We were able to purchase cold weather gear for our employees. So that way, when they were outside, they were protected from the elements. Through Nourishing Neighbors, we were able to purchase additional equipment. So of course, meal service during the shutdown looked much different during a regular school year. We had increased needs for cold storage capacity, coolers, styrofoam coolers, gel sheets, things along that line that were really essential to keeping, our organization up and running. And then, within FCPS, we're, fortunate to have very active school board members, leadership team, and principals who would communicate and say, hey, we're hearing that meals are needed in this community or in this part of the county. Could you look into it? And we use that input to build build the sites that we had and the bus routes that we've had throughout the pandemic. And in many situations, we're able to take information one day and have a site or a new bus route up and running within 1 or 2 days.
Amazing, absolutely amazing. All right, so now that the school year has ended, what's the plan for FCPS over the summer months for meals for students?
So we plan to continue, our efforts in providing meals to families throughout Fairfax County. And every year we provide meals to students and to children who are participating in school-based programs. So we're looking forward to all of the summer learning and summer enrichment activities that will be happening in the 176 locations that are currently planned for right now. And we will continue with our meal kits and our bus routes. So right now we have 10 schools that will serve as meal kit locations to continue to provide bulk breakfast and lunch. And then the same thing on bus routes. We previously had daily grab and go on the bus routes, and we're moving to meal kits this summer, and we'll continue to reach out and to be in as many places as we can. And we just want to encourage families to continue to be aware of the service and that this resource will continue even though school will be out for the summer.
Fantastic. All right, so now we're talking fall. When schools are back to normal and the students are back to school 5 days a week, talk to us about what the plan so far is for August 23rd when school starts.
Yeah, so we're very much looking forward to having students back in school in August for the new school year. Very pleased with USDA's announcement of all meals will continue to be no cost for breakfast and lunch. And then we're just going to continue to look at opportunities to support the communities and support our students and looking at what we might be able to do for snacks and supper this coming school year. But the main message is that, breakfast and lunch will be available, all kids will be back, and the meals will be no cost.
Wonderful. And I forgot to set my timer. So I'm hoping we have a quick minute to show this video. And I'm going to share this screen really quick. Give me 1 second to get this going. This is a quick video that our food nutrition services team started and created. Did I get the right? No, I did not get the right one. You know what? So I'm going to hold on 1 second. I need to stop this.
Is your personal writing assistant.
I need to stop this. Hold on. I'm going to stop sharing.
Strong essays and more, because sometimes the kitchen.
I did not hit the right I did not hit the right video for share screening. So we will try to pick that up at another time, maybe in our comments or Q&A. Sorry about that.
Thank you.
Thank you both. Kathy, we can hopefully put that into our follow-up email for this afternoon.
Would love to. And I'm so sorry I hit the wrong buttons. When you're working with 3 screens, it gets a little challenging at times.
No worries. All right, so now we're going to take a quick pause for the next few minutes to hear from some of the individuals that Arcadia serves in the community. Arcadia is a nonprofit organization dedicated to creating a more equitable and sustainable local food system in Washington, D.C. area. Founded in 2010, Arcadia's mission is to cultivate vibrant local food systems that prioritize health, equity, and sustainability from the farm forward. Enjoy.
Okay, so I'm representative of the Department of Nutrition and Food Studies at GMU, Our department is a faculty of 7 with expertise in clinical nutrition, food chemistry, community nutrition, sports nutrition, food security, and urban agriculture. We currently have 2 programs, an MS in nutrition of 39 credits and a graduate certificate in nutrition, which has 18 credits with 2 concentrations, a community nutrition concentration and a food security concentration. Our courses are pretty diverse. We have courses, pure nutrition courses, the macronutrients, micronutrients, nutrition through the lifespan, etc. We also have community nutrition courses that contain nutrition education, program development, global nutrition, and we have food studies courses that include fundamentals of cooking, food systems, food security, food and culture, and urban agriculture. If there's any questions about these programs, because we work a lot with actually several of you who are presenters and people in the audience, where we work on community projects and also send out students who volunteer or do their internships with many of the organizations that are represented here. Okay, so now I will introduce the next session. Our next session is Saving Local and Urban Agriculture. Both farmers markets and community and school gardens, 2 pivotal components of our county's agriculture landscape, shut down during COVID. In this session, speakers reflect on how the Fairfax Food Council Urban Agriculture Work Group not only reopened local gardens, but began to expand gardens and help people grow their own food. Speakers will also discuss how one Fairfax farm implemented new models of selling local produce. We have 3 speakers in here. The first one is Stacy Avers. She's a co-chair of the Fairfax Food Council Urban Ag Work Group and an environmental education teacher at Belvedere Elementary School for 10 years. Stacy runs Grow a Row Food Council, a network of gardeners growing produce for donation. The second speaker, it will be Huey Newcomb. She is a founder and owner of Potomac Vegetable Farms, one of the only working farms in Fairfax County. Huey takes care of the offbeat varieties of vegetables that grow at the Vienna farm, in addition to dealing with many details involved with running small businesses on a small budget. Chris Garris will be conducting a Q&A with Huey. Chris is the programs director for Bright Path, a nonprofit organization that develops sustainable solutions to stabilize low-income working families, build resilience through financial literacy and workforce development, and provide supports for children. She chaired the Fairfax Food Council from 2018 to 2020 and was a co-leader in the Food Provider Network. Stacy, it's yours.
Great. Thank you so much, everybody. Good morning, and thank you for joining us this morning. As Lillian said, I teach environmental ed in Fairfax County, and this is a photo of 2 of my students after one of our harvests this spring. I can't tell you how happy we were to be able to garden again. And this presentation tells what happened in school and community gardens over the last year and how the Urban Ag Work Group took action. In a nutshell, one of the top items that pantry clients request is fresh produce. Over the last year, the Urban Ag Work Group rallied to reopen gardens, is endeavoring to transform the productivity of school gardens, and is embarking on a plan to create more community spaces to grow food. When I talk about the Urban Ag Work Group, this is who I'm talking about, plus a number of community residents who care about growing food locally. Our vision is of a healthy, beautiful Fairfax County where fresh food is grown within walking distance of every kitchen. That's what we're shooting for. This map shows the county-owned gardens in Fairfax County. The red squares indicate the approximately 100 school gardens. The blue circles are community gardens owned by the Park Authority. They contain 671 plots. In late February and March of 2020, this is what was happening at my school garden and in other gardens in the county. We were planning what we'd plant using square foot gardening. We prepared for and hosted our annual seed sale, which occurred happily 2 days before everything shut down. And we learned about decomposition and compost by creating soil in newly built beds. This is how those beds looked on February 7th, and this is how they would remain for the next several months. When Fairfax County closed its school grounds and community gardens, we at the Urban Ag Work Group were very concerned. It was early March, and so we were already starting to plant. We worried about what would happen with the soil and weeds if the gardens went untended for a long time. And we were just aware of how much people needed to be in their gardens for their mental health. And it was such a chaotic and unnerving time. So we worked with Fairfax County Public Schools Get to Green and with garden coordinators in neighboring school districts to develop recommended guidelines for reopening the school gardens. And then we wrote letters of appeal to the authorities listed here. Similarly, we talked with community garden coordinators in neighboring jurisdictions to develop and propose suggested protocols. Collaborating with others, after a few months, our combined pressure finally prevailed and all but the school courtyard gardens reopened. The disruptions to the local food supply and the skyrocketing need for access to food made the work group rethink its relationship to school gardens. I mentioned earlier that Fairfax County has about 100 school gardens, but most of them are learning gardens. Productivity is not the point even when we plant. There's a lot of experimenting and exploring and digging in a school garden. The Urban Ag Work Group decided to buy bulk seeds so that any school that wanted to plant would have the means to do so. We also bought seeds for cover crops, which are crops that nourish the soil, hold moisture, and suppress weeds. We wanted garden coordinators to have an option that would protect their garden plots, but wouldn't require the same attention that food crops would require. And then we created a handout to explain cover crops. Next, the work group launched a pilot program in which we would work with a few schools to see what it would take to turn their learning gardens into production gardens. Working again with Get to Green, we identified a few schools that we knew had food gardens and enthusiastic educators who would be open to the idea. We selected 3 elementary schools and 1 high school in different areas of the county. So with those schools, we entered into a memorandum of agreement in which the Urban Ag Work Group would provide seeds and as possible other supplies. We would offer on-site support and if needed, grant writing help, and we'd also help them establish a harvest distribution system. The participating schools would sustainably maintain the gardens, even in the winter. They'd harvest in a timely manner. They would establish a distribution plan where the food that they grew would either go to their own families in need or that they would go to a food bank or food pantry, and then they would just keep us posted every month. The work group also paid for the educators to attend an online 6-week beginning farming class through Fakir Education Farm. And the class also included field trips to these 2 farms. Virginia Cooperative Extension arranged for master gardeners to support Lynbrook and Woodson. And you can see in the back, the man in the hat, that's Master Gardener Tony Macara, guiding students as they weed and harvest. And you can see how effective Tony's help has been from the weedy beds on the left to the really bountiful ones on the right. The food grown is delivered to Food for Others. Similarly, Stratford Landing, which is supported by work group partner Arcadia, donates its produce weekly to a local church. Lynbrook and Belvedere are both Title I schools, so they do things a little differently. At Lynbrook, families have adopted the garden plots. An Eagle Scout, he's up there in the upper left, moved all those raised beds from inside a courtyard to the front of the school so that families would have access to them even when the school building is closed. The school garden coordinator and master gardeners provide twice-a-month community gardening workshops to support the families, and they've been very well attended and received. Belvedere followed Lynbrook's lead, and now families are gardening in 10 of the plots. Food grown in the unadopted plots is taken by custodial staff and donated to Food for Others. So far this year, Belvedere has given about 55 pounds of produce away, and then we've also put stuff in backpacks for our students. The collaboration between the work group and the schools attracted the attention of FCPS Communications, which ran this story last week. It was picked up by local media outlets, and 2 schools have already reached out to say that they would also like to create gardens because they also want to grow food. Our plan is to continue the existing partnerships and expand modestly so that we can be as responsive and supportive as the schools need. The work group also focused on community gardens, looking at where the community gardens are located, who they're accessible to, and where there are gaps in service. So we could see that the most food insecure parts of the county didn't offer sufficient community garden spaces, or in many cases, there just weren't community gardens at all. The Park Authority is community garden coordinator, is a member of our work group, and she very much wants more community gardens, but the county can only work on land that it already owns and has a master plan for. This spring, the Urban Ag Work Group collaborated with Arcadia and Fairfax County Neighborhood and Community Services to create a new community garden at Gum Springs Community Center in the southern part of the county. The work group provided 4 fruit trees and the materials to build the raised beds, and then actually was on site to help. Here's Vivian Brown in front of her garden. Like the other gardeners, she's thrilled to be able to have a space to grow and to be able to eat plants that she wants to eat. Later this spring, the work group teamed with Arlington Boulevard Community Development, Virginia Cooperative Extension, and Kingsley Commons, a townhouse community in the eastern part of the county, to revive a garden that hadn't been used in about 5 years. My work group co-chair, Corey Suter, brought his sheep to do some weeding and drum up excitement before the first day. And I just have to say they were not the best weeders. This is but great for bringing attention. This is a before and after at Kingsley Commons. And over the summer, Urban Ag, the Master Gardeners, and ABCD will be holding monthly work days with families and a weekly kids garden. For the rest of 2021, the work group has joined forces with Soil and Water, Arcadia, Food for Others, and Cooperative Extension to help carry out a $50,000 grant to create or expand community gardens in parts of the county that most need access to fresh produce. And we're starting to identify candidate sites now. You can see that we have a deep passion for growing food and supporting other people who want to grow food. I hope you can also see that we truly believe in our vision of a beautiful and healthy Fairfax County where fresh food is grown within walking distance of every kitchen. So if you have a candidate site for us to look at, or if you want to have access to a garden but need help finding space, please reach out to me at stacy.evers@icod.com. You're also welcome to join our mailing list and come to our group meetings. Thank you so much for hosting this and for having me. And I need to hand it off. I'm so sorry. Now I'm going to hand it off to Hugh and Chris. I apologize.
So thank you so much for coming and sharing your perspective as a farmer. Next screen, please. So how did you get started in agricultural business back in the 1960s?
Well, I certainly was not thinking about being a farmer. I was supposed to be a school music teacher, but my husband had other ideas. He would love to be growing sweet corn and learning how to farm so that eventually we could create an ecological learning, agriculturally based intentional community. Well, we got started in the early 60s. I planted our first crop of sweet corn on rented ground near Tyson's Corner, where it was still, when it was still a crossroads. We didn't know then how big a role we would play in the local food movement in the next 60 years. That's amazing, since we knew nothing about farming, had no land, and just my husband's small salary as a government economist. But he grew up in northern Fairfax County, which was still rural, and Fairfax County had a lot of dairy farms. But by the time we came on the scene, many of these older dairymen had retired because their families were not interested in farming. And we found retired dairy farmers willing to rent us their beautiful pastures for $25 an acre. And we bought used equipment at farm sales in Pennsylvania and Maryland. And we hired college friends and students to help us. And many of these college students were very eager to work, but they had no clue, just like we didn't, about what to do. And so we started a beginning farmer program in June in the 70s to train them. Year by year, we learned to grow more and different vegetables organically. We sold at our roadside stand and at farmers markets. And eventually we were able to buy land in Fairfax and Loudoun counties. And as the rented ground that we had been using around Tyson's Corner got more developed. The Loudoun County farm story was wonderful. I mean, in the mid 70s, we found 400 acres that was so gorgeous, but it was more than we needed. And required much more money than we had. So we found 5 other farmers who were willing to buy parts of it. And those 5 farmers and others have that ground is still in agriculture and is the center of a huge community of young farmers. And it's very exciting. During the, I guess we want to find out, oh, we, as we were hiring these students, we couldn't pay them very much. And even now their income, I mean, their wages are small compared to what they could earn in the office in a city, but they had no interest in working in an office in the city. They wanted to learn how to grow vegetables. It's such a pleasure to work with these young people. And if they stay long enough, if they work 3 years out of the, if they work 3 years, they become eligible for us to give them contributions to their SEP IRA accounts. We feel that, and we only do that when we have a good year, but we've had in the last few years, several good years, and they can get a percentage, sometimes as much as 25% of their gross income as a contribution to their SEP IRA. Let's see, I guess we can go to the next slide.
All right, wonderful story.
When COVID hit, everybody was very worried about where they would get their vegetables because the markets, wasn't sure that the markets would reopen. But we did have a community supported agriculture program already. We've had a CSA, that's community supported agriculture. We've had it for almost 20 years. And some of them we delivered to, and many people came to the farm to pick up their shares. That model is amazing. These people they sign up in January, give us their money, sometimes hundreds of dollars, and they don't see any vegetables until June when we have them. And then they're so excited when they come. It's such a pleasure to interact with them. At the farmers markets, we had to figure out how to redesign our displays because the CDC said they couldn't just touch and pick out their own stuff. So we had to bag them in clear plastic bags and change our checkout systems so that they were mostly credit cards for a safe sell. And some markets continue to do very well and others not so well as people returned to the markets. At the same time, our CSA, our Community Supported Agriculture Subscription Program, doubled because people were not sure they could or wanted to shop at the farmers markets and at the supermarkets. To meet the increased demand, we bought produce from farmer friends who had lost their restaurant wholesale accounts or had chosen not to return to the restricted farmers markets. But sometimes we end up with more produce than we can use, and we send them to food banks like Food for Others and Arlington Food Assistance Center. And we also provide vegetables at the Crossroads Farmers Market in Tacoma Park at lower prices. This market serves a large community of Latinos and Asians. For many years,
I think you're talking with the last slide. Let's move on to that.
Okay, thank you. For many years, we have served seniors and families enrolled in the WIC and the USDA Farmers and Market Nutrition Programs, and our daily veggies as well. It turns out it's not surprising that many of the markets we go to are not patronized by people who really need this food and live in areas that are poorly served. And so being able to send food through these through Food for Others and your and the grow row thing, that makes it our vegetables that we have, which are so beautiful and delicious and grown in a way that I feel is really a regenerative way to treat our soil. And so it's great to be able to send the food to these areas.
And I know the food banks and our families really appreciate that, Hugh. Thank you so much.
Do I still have a little bit of time?
I believe we are out of time. Maybe
Okay,
just,
that's fine.
Maybe just one-liner.
Oh, well, we're just hoping after the pandemic that we can return to having farm visits and tours with schools, because I think it's so important for these children to see food grown, and their parents too, and to understand why we grow vegetables the way we do without any pesticides and commercial fertilizers. Thank you.
Absolutely. Thank you.
Thank you, Stacy, Chris, and Hugh. Our last session of the day will talk about meeting the challenge of increased demand. As the nation shut down last spring, unemployment rates in Fairfax County rose from 2.1 to 10.2% in just 2 months. This rapid loss of employment forced many to use a food pantry for the first time. According to Fairfax County Coordinated Services Planning, the average number of new cases opened in FY20 was 426 per month, up from 244 per month in FY19. In this session, speakers will describe how food assistance providers work together to increase their capacity. We'll first hear from Cynthia Singizer, the Senior Director of the Northern Virginia region for the Capillary Food Bank. In this role, Cynthia is responsible for ensuring that hunger needs are met across Northern Virginia. Cynthia identifies and implements partnerships with new, non-traditional food and other social actors on ways food can help enable pathways toward greater financial and sustained food security. She also oversees the Capillary Food Bank's warehouse location in Lorton, Virginia. Then we'll hear from Pamela Montesinos, the Director of Client Operations for Western Fairfax Christian Ministries. Western Fairfax Christian Ministries distributes food through their Client Choice Food Pantry and directly into local communities, serving hundreds of families each month.
Thank you, Annie. And I just want to say, wow, the presentations so far have been so impressive. And thank you all for being here today. The Capital Area Food Bank is the region's largest hunger relief organization. And as such, we acutely felt the impact of the pandemic on the population that we serve in our communities. Next slide, please. Please bear with me. My presentation is fairly data heavy, but we'll get through it together. As Annie mentioned, the unemployment rates in Fairfax and in the region spiked during the pandemic. And since March of last year, there have been over 900,000 unemployment claims filed. This had a direct impact on the food insecure population in our region, which increased from over 400,000 food insecure individuals pre-pandemic to over 6,000 at its peak during the pandemic. The food bank's operations were also disrupted by the pandemic, and we saw a disruption in our food supply chain, resulting in a 75% decrease in retail donations, which the food bank heavily relied on before the pandemic. As a result of this decrease in donated product, we had to purchase much more food for our partners and distributions in the region. We purchased over 790 truckloads of food since last April, which is 26 times more of what we purchased in the prior year. Specifically in Fairfax County, the food insecure population increased to a peak of over 121,000 food insecure individuals, which is double what it was the prior year. Our distribution network was also disrupted. Many of our nonprofit partners in Fairfax County had to close due to safety and concerns about staff and their ability to continue to distribute. So the result was that we had to get more food out to the community through a smaller distribution pipeline. Next slide, please. The increase in demand was a direct result of a newly food insecure population. In March and April of this year, the Capital Area Food Bank conducted client surveys to learn a little bit more about this newly food insecure population. And the results were interesting and different from what we saw before the pandemic. 69% of respondents identified as newly food insecure, which is up from 26% reported before the pandemic. Interestingly, in our region, Fairfax reported the lowest new food insecure population, with other jurisdictions seeing a much stark increase in that newly food insecure population. The population is a younger one. Its average age was 46, whereas before the pandemic, we saw more of a senior population accessing food access points. They're significantly larger households, more likely to have children. And as we've heard a number of times in our presentations, we know that this population is much more likely to be Hispanic. In fact, respondents are 3 times more likely to be Hispanic. This population is also facing a greater housing uncertainty, with 36% worried about eviction. They're also more likely, this is interesting, they're more likely to be working. 66% are employed in some form or another, compared to 40% pre-pandemic, which speaks to the question somebody raised in the Q&A. The cost of food has increased so much that even though people are working, they're not earning a high enough living wage to be able to afford the food that they need to for their families. So even though more than half of the population is working, they're still accessing food through emergency food distributions. This newly food insecure population is also less likely to know of where multiple locations are where they can access food. They are probably attending one distribution point and aren't aware of other ones in the area that they can access food on different days or at different times. And also, this is a more severely food insecure population. And according to the USDA definitions, that 65% of these individuals accessing food fall in the low to very low food secure group. Next slide, please. So how did we meet this increase in demand in Fairfax County? The Capital Area Food Bank associates a meal as 1.2 pounds of food. So while you heard from the school system that they were delivering meals, we deliver food more in a grocery type product, in individual ingredients and products. So during the pandemic and the last year, we distributed over 14 million meals just in Fairfax County, compared to 5.3 million meals the prior year. We distributed these meals through our distribution of network partners, many of whom are on this call today. But as you saw, with the closure of some partners, we also had to set up some temporary non-traditional partnerships with also many of you on the call today. And these new temporary partners either were replacing a partner that maybe had to close, or were setting up in one of these, a neighborhood where there is a newly food insecure population. And they contributed a significant amount of the food distributing over 2.3 million meals in the high need areas. We were very fortunate to be recipients of the USDA Farms to Family Program emergency food boxes. Northern Virginia accessed quite a few of them, distributing over 6.5 million meals through this program, which started back in May and ran through May of this year. We distribute these boxes through our shopping partners, our nonprofit partners with the food bank, and this temporary network of partners that came up as a result of the pandemic. And we did all of this through collaboration with so many of you on the call, then we couldn't have done it without you. The collaboration with supervisor offices, NCS, Fairfax Food Council, faith-based community partners, Fairfax County Public Schools, and the Food Access Committee. It wouldn't have been possible without you all. It was truly a team effort, and we are so grateful to have worked with you all on this response to the crisis. And with that, I'm going to turn it over to my colleague and partner, Pam from WFCM, who will talk about how they met the demand. Thank you.
Thank you, Cynthia. Well, I just want to talk about what we did and what we accomplished during this pandemic with all this partnership, right? So next slide, please. We partnered with Sully District Supervisor Smith Office to provide thousands of farmers to families boxes during June 2020 to May 21. These boxes have different items. You can find a gallon of milk, you have apples, potato, onions, different kind of meat like a meatball or hot dogs. For these boxes, there is not eligibility, so no questions were asked. Anybody that was in the line can receive these boxes. So we work with 14 CBOs and we distribute 1,200 boxes each week at Mount Olive Baptist Church to pick up them every Monday. So it was a great partnership with a lot of fantastic volunteers on site. As you see in the picture there, they help us to load the cars, to move the pallets. Was a really great opportunity to know each other and to collaborate together for the community. During fall and winter time to 2020, we were working with the Fast Run to distribute food to the neighborhoods in Centerville, Chantilly, Ox Hill, and Fairfax. So every other Friday, we went to different neighborhoods with all the food that we have here in the pantry. So because we close during weekends, on Fridays, we have bread, we have perishable that won't last until Monday. So we use the Fast Run, we loaded up the car and we went to this neighborhood. And this was really appreciated with the community. We serve around 250 families monthly, in addition to our regular food pantry appointments that is 500 per month. So, and we see that there is a need. This pandemic really hit really hard to low-income communities. So was a really huge help for these communities. Next slide, please. And we know transportation is always an issue. So we work with two fantastic partners. One was Western Fairfax Shepherd Center and MB Rice to provide deliveries for families that were either in quarantine or they don't have transportation to come and pick up their groceries. And because we really need that families have the right to choose how they feed their families, we make sure that we ask each family what are the items that they need and they don't need. So we try to accommodate all these deliveries to serve as best as I can to our clients. So if they have a need of sugar or oil or protein, or they don't need pork, we try to accommodate and send the food that they really want and they really need. So we targeted 8 different neighborhoods here in Chantilly, Centerville, Oak Hill, Clifton, and delivered this food with these wonderful volunteers. So previously, of pre-pandemic time, the transport was offered just only for 50 years and older, but now we are delivering food for everybody that are in need of transportation and food. Next slide, please. Okay, so I forgot to mention, in January, we bought our van. So now we have our own van and we are going to the neighborhood. And this has been fantastic. Right now, we can just load up our van and go to this neighborhood. And we always communicate with the manager of each neighborhood, right? So the neighbors or the community knows that we are doing a certain day, a certain time. And when we show up, the families are already lined up, ready to receive the food that we are bringing. In April, through grants and donation, we purchased a walk-in cooler, a walk-in freezer that you can see Harmony there in the picture, that this has been a fantastic time during this time. So now we can store more food, we can serve more clients, and we will never say no to any kind of donation. And now we have a really nice project that is the free food fridge, that is a satellite side refrigerators to stock healthy food. We are partnered with two different non-profit organizations, and we are putting there a fridge that will be in charge to put the food inside, healthy food, and we will rotating the food every day. So, for example, Boys and Girls Club will be access to have this, deli meat, sandwiches, meal for the kids that go to this camp. Thank you.
Thank you so much, Pamela and Cynthia. Now we'll have just about 10 minutes for questions and answers led by Chris Garris.
So I'd like to ask the panelists to go ahead and get on to the camera and also the microphones. And thank you so much for your perspective and your time today. I'm sure we've all learned a lot. And I'm going to put the first question to Cheryl. And that is, were there any legal hurdles to going from in-restaurant dining to carry out? So Cheryl, are you with us?
Hi, I am.
Okay.
Yeah, so there really weren't a lot of hurdles. The local government, as well as Virginia ABC, really put some legislation in place recognizing the challenges that indoor dining was facing. And that made it pretty smooth and pretty easy to transition over quickly.
Well, that's refreshing to hear.
It is.
That's wonderful. And the second question we have is, what are the forecasts for food insecurity in Fairfax County for the next 3 to 5 years? And that one was for Cynthia.
Yeah, thank you, Chris. We just got some projections for fiscal year 22 from Feeding America, our national network for food banks. And the food bank we have a really strong data-driven analytics team, and we like to take a look at what Feeding America used to come to their numbers and add any more local flavor that we think we can. So we'll be reviewing that data now and coming up with our own projections. I don't think anybody's gone out as far as 23 and 24. We will be closely monitoring it. The reason why we like to look at our local numbers is because we're in contact with so many of the partners out on this call and who are distributing the food, who haven't seen much of a drop off in attendance at food distributions. And some of the numbers that people are sending us are saying that it's declined, the need has declined more drastically. So we just want to make sure that we're balancing what we're seeing in the communities with the projections. And, they're just projections, so they're going to vary.
Thank you. So the next question is for all the panelists. So please let me know who would like to answer this first. One thing you learned during COVID that you will continue doing. Don't make me call on someone.
I'll start. This is Kathy with FCPS. Maria had to go. With our food is very determined as to the school day and the requirements of the school day and that type of thing. But one thing we know that we will be doing is continuing the deepen the collaboration with our food partners in the community with our supplemental food programs, the weekend food bags, the food pantries in our schools, and those types of programs, and just continue deepening those relationships so the food insecurity within our schools on the weekends and when we cannot provide meals to students at weekends and evenings is lessened.
And I can go next. This is Marley. I would say that failing forward is something that we just kept on doing. So we didn't give up, and success only knows, you only know success by the measure by failing, and to not be afraid to do that. And I have to also include, keep your cheerleaders near you in times of crisis. It was so important, imperative for us to be able to have people that were for us and in our corner.
Hey, it's Cynthia. I can go next. I think we will continue to diversify our partners in the community and look at making sure that we're supporting our traditional network of food partners and distribution sites, but also looking at some non-traditional and less conventional sites. I think everybody learned that we need to diversify the places that we're distributing food. So we'll continue to work on that.
I'll go next. So one thing I would add is collaboration and knowing the players are just key. When I looked at starting this food pantry at Inova, that was something I had never done before. And I was constantly asking Cynthia from Capital Area Food Bank and Annie from Food for Others, how do I go about doing this? How do I get the food? And if I didn't have those relationships already established, we probably would not have been able to start it at Inova, or at least as successfully as we have.
I think one thing that we learned at the Urban Ag Work Group is that there are some gaps in local policies and regs that make it really hard for small scale folks to set up agriculturally. And that's something that we'll be probably pursuing, just to make it easier for people to grow food either in their yards or on a property that's under 2 acres.
Sharon?
I can go just next real quickly. It's technology. Before we conducted the interviews in person, but now people know how to use Zoom, how to send documents by email, and different other platforms. So we are planning to continue doing the intake interview by phone, using emails or whatever we need to use to help the clients, because we know transportation is an issue. Thank you.
Sharon?
Hi. So my work in public health is to build capacity, collaboration, and speak of policy systems and environments at the population health level. And what I've learned through this pandemic is that in lifting up our work, we do need to seek to humanize our residents' ability to thrive so that all in our community can achieve a quality of life that promotes health. I mean, what we've seen today, these photos and the work at hand tell a million stories, and making sure our community of 1.2 million residents thrive is really starts with the smile on folks' face and their deep appreciation for all the work that we've all done.
Wonderful. Lorianne?
Yeah, I just wanted to say that I think with us, collaboration and deepening those relationships also is going to be a priority with us, but also educating. With this program, it wasn't just about feeding families these culturally appropriate meals, but also giving Fairfax County small food businesses the backing that they needed to make it through the pandemic. So it's twofold. And so realizing that those business needs to keep them afloat are equally as important, and in feeding the families. And these companies got pride from participating in this program.
I'd like to give a shout out real quick to Fairfax County and the food access meetings that formed very quickly and brought in so many partnerships where weekly we could learn what each others were doing and try to fill those gaps, and also make sure we're not working in an area that already has a lot of food access. It was extremely helpful, and I hope that continues on. And I believe, Annie, we're reaching our point. But we do want to let you know that we are going to take the questions that have been asked, And with all of our summits, we will have meetings with the Fairfax Food Council. We ask you to join us and we can further these discussions and hopefully get those questions that we weren't able to answer today answered.
Thank you, Chris. We hope you've all been inspired by the presentations you've heard today. I know I have. As Diane mentioned in her introduction, this is just a sampling of the many, many collaborations that occurred among government, business, faith-based organizations, schools, and nonprofits over the past 14 months. Thinking back to the themes that were presented at the first Food Equity Summit in 2019, one can't help but see how far we've come in just 2 short years. Topics we discussed back then were rooted in the 5 dimensions of access and focused on improving equity in our food system. Ideas such as providing culturally appropriate foods, making healthy foods more available, considering the accessibility of food distribution locations, and providing a safe environment for food distributions became the solid foundation for the problem solving that occurred during the pandemic. As we move into the next phase of the pandemic, we don't want to lose ground on the progress we've made. It is predicted that food insecurity rates will remain high for at least the next several years as community members reach for stability. We've experienced the collective impact we can have if we work together and truly listen to and incorporate the needs of our most vulnerable community members. Let's build on these groundbreaking programs and partnerships and figure out how to continue to empower equitable food solutions in Fairfax County. If you or your organization are passionate about food system issues, healthy eating, food access, and community gardens, please contact the Food Council or the Food Access Group, as Chris just mentioned. The follow-up email for this event will include information on how you can get involved. In closing, we'd like to thank you all for attending the summit today. A huge thank you to our inspiring speakers, the summit committee members, Diane Charles, Chris Garris, Kate Garson, Don Hyman, Cynthia Singizer, and to Terry Ann Guingab with George Mason University for her technical expertise and helping keep us all on track today. Our follow-up email that you will receive later this afternoon will also include an event evaluation. Please take some time to fill it out and let us know your thoughts so we can incorporate them for our food summit next year. Lastly, don't forget to pick up your delicious lunch at the Government Center Parking Lot B between 12 and 2 today. Thank you.